Most of us have been taught that it's always good to play it safe, and in medicine it's no different. But when it comes to atrial fibrillation and the risk of falling, our gut feeling often is the exact opposite of what the gold standard evidence tell us to do. I'm a cardiologist and chief medical officer, and I see this clinical paradox every week. We avoid life-saving treatment because we are afraid of a fall, or we stick with aspirin because it feels safer. But did you know that the guidelines actually classify aspirin as a potentially harmful treatment for atrial fibrillation when it comes to preventing stroke? I just posted a full breakdown on how I use a free tool called NotebookLM to lock in the 2023 ACC guidelines. It takes this 150-page document and gives doctors and patients total clinical certainty in seconds. I'm going to show you exactly how to ground this AI in fact so that it never makes things up. Click the link in the comments to see a full demo and learn how to navigate this aspirin trap for yourself or your loved one. Look, I'm going to be straight with you. Being a doctor and making the right diagnosis every time can be harder than ever. And it's not because we don't have enough information. It's actually because we have too much of it. The gold standard for how we treat you is a moving target. Most doctors are doing the absolutely best they can, but we are only human. We can't memorize every page of every 150-page guideline, but that's where a new tool called NotebookLM comes in. It's a free tool from Google, and it's basically like having a world-class expert sitting right on your shoulder during a clinical visit. Let me show you why this tool is different than any other AI that you've seen or used before. Imagine your 76-year-old mother just had a mini stroke, also known as a TIA. She has some blockage in her neck on a carotid scan. She has high cholesterol, she has hypertension, and she has diabetes. While she was in the hospital, a monitor caught her having a heart rate that was irregular and diagnosed as atrial fibrillation. This lasted for about 6 hours. She's already on aspirin. Incidentally, she didn't really feel that she was in atrial fibrillation. Of note, she also has a history of a GI bleed about 10 years ago. On paper, this is a pretty complicated scenario, but here's the part that usually stops everyone in their tracks. Mom does not have great balance. She falls a couple times a year, and this is where the fear versus evidence comes in. When a doctor or a family hears she falls, we usually freeze up. We think if we put her on a blood thinner, she's going to fall, she's going to hit her head, and that's game over. But look what the guidelines actually say. So I'm going to tell you up front, if you gave that scenario to 10 different cardiologists, I absolutely will tell you that you are going to get 10 at least slightly different, and in many cases, very different recommendations on how to treat that exact same patient. And that's not because they're not trying to do the best they can, but because there is a lot of gray area when it comes to atrial fibrillation, and it's very difficult to know exactly what to do in every unique situation. But this NotebookLM is going to really help us sort out those gray areas, sort out the gut feeling versus the facts, and help figure out what the best case treatment for your mother is. So in this situation, we'll go ahead and put in all those facts we just mentioned into NotebookLM and simply ask it, what is the best guideline-based treatment for this patient, in this case your mother? We'll talk about what the bleeding risk is and what the recommendation should be, with citing the exact sources about why this information is indeed the best treatment strategy for your mother. So this is NotebookLM, and it's free, and it's a very powerful tool. The secret is you don't just ask it questions, you first have to go to the American College of Cardiology website for this example that I'm using here, and I'm going to go ahead and download the atrial fibrillation guidelines, and I'll drag that PDF right into the sources section here. And this is why it matters, because unlike other AIs, this locks in this data source as the sole source that it's pulling from. It's not pulling from outside Reddit or some old blog post. It's grounded strictly in the gold standard evidence. There's no guessing, no confabulation, just facts. So we'll simply go ahead and paste in our question. A 76-year-old female with a recent TIA or a mini stroke, 6 hours of atrial fibrillation that was witnessed in the hospital, no symptoms. Other factors, risk factors include hypertension, diabetes, hyperlipidemia, and currently on aspirin. She also has a history of 3 to 4 falls per year and broke her wrist 2 months ago. What do the guidelines say we should do in regards to treatment for this patient to prevent future stroke events? That's the simple question. It's actually quite a complicated question that I already told you 10 different cardiologists would give you 10 different answers. But the real question we're looking for today is, what do the expert guidelines say? Why do they say it, and what is the evidence supporting it? All right, so here is the answers in just a few seconds, and as you see, a very detailed example of, from the guidelines, how this patient should be treated. I'm not going to go through all the details here. A lot of it is technical and, quite honestly, more tailored to a cardiologist, but I will say that you simply could ask it to give this in more simple terms, and it would do that. Nonetheless, the short answer is this patient is a very high stroke risk. Anticoagulation is strongly recommended, regardless of the fact that the AFib was only for 6 hours. The fall risk thing does bring up the idea of alternate therapy, such as things like a left atrial occluder device, sometimes known as a Watchman. Aspirin is not recommended, at least not for stroke prevention. And then it goes on to give a full list of comorbidity management. In other words, other things that we can do to try and reduce future risk of stroke and reduce complications from the atrial fibrillation. So, I consider myself a pretty good cardiologist, but I have to say I've never given quite this detailed of a response for a patient like this. And this is a tool both for doctors and potentially for a patient or a family member who maybe isn't getting the information that they want from the provider. And I would caution you to not use this as a club, but as a guideline, as a basis for discussion, and really help you in some ways be the most informed person in the room as to advocating for yourself, for your family members, and what is best based on current guideline evidence. All right, there you have it. I hope you learned something today, and if you did, please consider liking the video and subscribing to the channel as I continue to add new content every month. Also, if you'd like to have a detailed report out on how to do this yourself for your own records or to pass on to somebody else, please leave a comment in the chat, and I'd be happy to send you that detailed instruction list as we continue to live, learn, and grow in this brave new world of AI together.